Iron deficiency anemia is a common type of anemia that occurs when there is not enough iron in the body to produce sufficient hemoglobin, the protein in red blood cells that carries oxygen. Without adequate iron, your body can't make enough healthy red blood cells, leading to a range of symptoms. Here's a comprehensive overview. Causes iron deficiency anemia can result from several factors, including inadequate iron intake, diet, low iron intake from the diet, especially in individuals who follow a vegetarian or vegan diet without adequate iron sources. Increased iron needs. Pregnancy, increased iron requirements during pregnancy. Growth spurts, higher iron needs during childhood and adolescence. Blood loss. Menstruation, heavy menstrual periods can lead to significant iron loss. Gastrointestinal bleeding, conditions such as ulcers, hemorrhoids, or cancer can cause chronic blood loss. Frequent blood donations, regular blood donation can lead to iron depletion. Poor iron absorption. Gastrointestinal disorders, conditions like celiac disease, Crohn's disease, or gastric bypass surgery can impair iron absorption. Chronic diseases. Kidney disease can affect red blood cell production and iron metabolism. Symptoms of iron deficiency anemia may include fatigue, feeling unusually tired or weak, paleness, pale skin and mucous membranes, shortness of breath, feeling breathless, especially with exertion, dizziness, lightheadedness or dizziness, particularly when standing up quickly, cold hands and feet. Poor circulation can lead to feeling cold. Headaches, due to reduced oxygen delivery to the brain. Brittle nails, nails may become thin, brittle, or spoon-shaped koilonychia. Restless legs syndrome, a strong urge to move the legs, especially when resting. Diagnosis of iron deficiency anemia typically involves medical history and physical examination. Review of symptoms, discussion of symptoms, dietary habits, and medical history. Physical examination, checking for signs such as pallor and abnormal heart sounds. Laboratory tests. Complete blood count (CBC) to assess red blood cell count, hemoglobin levels, and other related parameters. Serum ferritin, measures iron stores in the body. Low levels indicate iron deficiency. Serum iron and total iron binding capacity (TIBC) to evaluate the amount of iron in the blood and the blood's ability to transport iron. Transferrin saturation, indicates the percentage of iron binding sites on transferrin that are occupied by iron. Additional tests. Stool test, to check for occult hidden blood in the stool if gastrointestinal bleeding is suspected. Endoscopy or colonoscopy may be required to investigate potential sources of gastrointestinal bleeding. Treatment for iron deficiency anemia focuses on replenishing iron stores and addressing underlying causes. Iron supplements. Oral iron, ferrous sulfate or other iron supplements are commonly used. These should be taken as directed, usually on an empty stomach for better absorption, and can cause side effects like constipation or nausea. Intravenous iron, for severe cases or when oral supplements are not tolerated or effective. Dietary changes. Increased iron-rich foods, include more iron-rich foods in the diet, such as red meat, poultry, fish, legumes, dark leafy greens, and fortified cereals. Enhance iron absorption. Consume vitamin C-rich foods e.g., citrus fruits, bell peppers with iron-rich meals to improve iron absorption. Addressing underlying causes. Treating chronic conditions, managing any underlying health conditions contributing to iron deficiency. Controlling blood loss, addressing sources of chronic bleeding, such as managing heavy menstrual periods or treating gastrointestinal disorders. Monitoring. Follow-up, regular follow-up with healthcare providers to monitor iron levels, adjust treatment, and ensure recovery. Preventing iron deficiency anemia involves balanced diet, consuming a diet rich in iron and vitamin C. Regular check UPS. For individuals at risk, such as pregnant women or those with chronic diseases. Iron supplementation, as advised by healthcare provider, especially for those with known risk factors. Conclusion: iron deficiency anemia is a manageable condition with proper diagnosis and treatment. If you experience symptoms or are at risk, consult with a healthcare provider for evaluation and personalized treatment. With appropriate management, most individuals can restore their iron levels and improve their overall health.